Hello and good evening from all of us here at Prasanna School of. We are excited to welcome you all to the fifth virtual lecture of the Professor Rajani Prasanna Endowment Lecture Series on climate change and its impact on public health. Before we begin, we wish to wholeheartedly thank Professor Rajani Prasanna for considering us for the endowment, enabling us to connect with eminent researchers and policymakers from across the globe to deliberate and disseminate the impacts of climate change on various facets of public health. We are grateful to our chief patron, Sri D.A. Prasanna, for steering us towards new endeavors that will enable us to achieve our aspirations. We'd like to thank the whole MAHE community for all the support and our founding director, Professor Helmut Brand, for being with us all the time. This virtual meeting this evening is all about a deep exploration to understand the concept of climate change in a world of changing realities and plan for the challenges ahead in the road of public health. I'd like to introduce now our speaker, Major General Professor Atul Kotwal, Executive Director, National Health System Resource Center. Major General Dr. Professor Atul Kotwal is a medical professional, public health researcher, administrator, educator, mentor, and a teacher with significant contributions in the field of public health for over more than 37 years. His areas of expertise include health systems, planning and implementation of healthcare policies, primary healthcare, urban health, epidemiology, health technology assessment, implementation research, and interdisciplinary research. He has received his MBBS followed by MD in Preventive and Social Medicine from Armed Force Medical College, Pune. He also holds a postdoctoral fellowship in epidemiology from Clinical Epidemiology Unit, All India Institute of Medical Sciences, and Center for Social Medicine and Community Health, Jawaharlal Nehru University, New Delhi. Dr. Kotwal has a diverse experience, including serving in the armed forces across all levels of medical corps in India, to being an advisor for public health in Botswana, Africa, and in providing technical support to Government of India as Officer on Special Duty Public Health in the erstwhile Planning Commission. In his tenure as OST Public Health in Planning Commission, he was involved in planning and finalizing 11th five-year plan, reviewing NRHM, and conceptualizing urban health in addition to WASH and women and child development related activities. Dr. Kotwal has received numerous awards for his contribution to the armed forces and towards his professional and research achievements. Notable ones being Sena Medal and Vishishta Seva Medal by the President of India, commendations by the Chief of Army Staff and Army DR, 8 Best Research Paper Awards and 2 Best Research Project Awards. He has also been awarded the prestigious Dr. J.E. Park Oration by the Indian Public Health Association. With more than 140 publications in index journals, he has contributed to the evidence generation and knowledge sharing through designing and undertaking research and providing academic support in the field of public health. Climate change not only has direct impact on human health, but also threatens the capacity of health systems to manage and protect population health. Health systems should therefore be increasingly strengthened so that they continue to be efficient and responsive to improve population health in an unstable and changing climate. With this short brief, I invite our honorable speaker today, Major General Professor Atul Kotwal, to this forum. Over to you, sir.
Good afternoon, everyone. Thank you for the introduction. And I would just like to place on record my utmost gratitude for being given this opportunity of this endowment series, lecture series, to be part of this. We all know the contribution of Rajani Prasanna and also what the MAHE stands for. And it's very heartening, and also to like to share with everyone that we have an open-ended MOU with MAHE from the NHS side, and greetings from NHSRC also to begin with. So I will, before I think I'll go to the actual topic of climate resilient health systems and policies in India. I would like to flag few issues here that climate change, of course, is certainly without argument the most serious global environmental crisis that we are. It's not only environmental actually. It's unique in its multi-scalar characteristic from global to local, and at the same time there are many people in the world for whom climate change is becoming now existential problem, while on the other hand there are many who are just not affected by it or apparently not affected by totally unaffected by it. So it's a major issue. At the same time, it doesn't affect all right now. whether they perceive it or not, but eventually it affects us all. And the scale, as I mentioned earlier, global to local. I would like to flag another issue here. There have been many, kind of conferences, international conferences, discussions. You all are aware of those. But somehow the developed world has really been very poor compared to their capacities and wealth and their promises. There's a lot of push on the developing countries like India, which have mentioned that it should be looked into with the entire developmental paradigm. But at the same time, since it's an issue which is affecting the entire globe, we can't say that we will not do anything. So that's why India is taking effects. But at the same time, the targets and all which are mentioned there need discussion in a bigger forum. So it's not only the city planning, the transportation, but even in the health sector. So coming now to the main topic for today, which is the effect on the health sector, the Government of India's initiative. Before that, I would like to request your indulgence to a little bit to slightly kind of a recap for all of us. We all know what climate change is. We are aware that it impacts the health, and the short to medium term effects are determined by the vulnerability of the populations, their resilience to rate of climate change, and of course the pace of adaptation. And in long term, it will affect finally what are the actions taken to reduce the emissions, to avoid breaching of dangerous temperature thresholds, and also how to avoid potential irreversible tipping points. On human health, as we all know, I think that this also would be probably seen by many of you, adapted from the CDC documents. The more extreme weather leading to affecting the living conditions and social inequities, changes in vector ecology. So the diseases like malaria, of course, in India we have tremendous control over it right now, but you never know, because of environmental change we may have a resurgence this thing, and the other vector-borne diseases which are now increasing. Air pollution, increasing allergens, water quality impact, and of course with increasing CO2 levels we have water and food supply impact, which will come up later on, which will eventually affect the nutrition. So with increasing CO2 levels, of course it will impact the water and food supply, and leading to various malnutrition and diarrheal diseases and all also. With severe weather, again, injuries, fatalities, loss of homes, mental health impact, extreme heat, and in fact extreme cold also, because some parts of the world may lead to may face that too. And of course environmental degradation with leading to migration, and we all know when the forced migration may lead to civil conflict and also mental health impact, loss of jobs and of income as such. So how are the climate change and health systems are connected? We've seen the impact on health, but then on the climate change and health systems are connected in both ways, two ways. There's a growing health threat for climate change, which we have just now seen, the injuries and vector-borne diseases, weather events, zoonotic diseases, and the health systems are as part of the problem, because 4.4% of global greenhouse gas emissions are basically by the health sector. So we are both the contributors as well as the one who are going to be impacted because of this, and current health systems, as we all know, are inadequately equipped to manage these changing health risks. And there are many developed countries where vector-borne diseases, over the years, if they don't have communicable diseases, there are the challenges in management of those two, especially communicable diseases, vector-borne diseases. So just another look at that. What are the vulnerable factors which I mentioned earlier in short term? How we it will impact. These are demographic factors, geographic factors, biological factors and health status, socio-political conditions, socio-economic conditions. And when you come to the exposure pathways, the extreme weather, heat stress, air quality, water quality and quantity, food security and safety, vector distribution and ecology. And of course, when you link with the health system, the resilience is the word which I think it's very, very important now. But that the factors are leadership and governance, how the leadership reacts. Like in COVID, we have seen how each country reacted to its response. From initial initial diffidence to the confidence later on, and how each country looked at the strengthening the systems, and also looking at the vaccination program, making the delivery of medicines available, health workforce, their capacity building, health information systems, medical production technology, service delivery, and financing. I'll be discussing few of these points again. That's why I'm not going into details here. Health outcomes and health systems outcomes. So the climate change is linked with both as such, and these are the few of the which sector contributes how much in the emissions as such. If you see the agriculture, forestry, of course, the maximum 24, almost just like electricity and heat production. Industry 21, transport, buildings, other energy, and of course another 4.4% is the health sector. So there's a report in 2019 which for the first time in fact flagged this issue of which sector is contributing how much and how much is the healthcare's climate footprint. So that's a report which I am quoting when I'm saying 4.4, and it has been peer reviewed and discussed in various protocols too. So if you go country wise, if you see healthcare's climate footprint, the more the country is spending, the proportion of GDP spent by a country, the more is the healthcare impact on the climate change as such. So I'm not saying that you should not increase the proportion of GDP spent on health. That we need to do definitely, but at the same time we need to address these issues when we are spending on health as such. So in India, in our healthcare climate footprint, if you see, there are three kind of major blocks. If you see, the first one is the healthcare facilities themselves, and also the vehicles used by the healthcare. So that's where immediate action can be taken to reduce healthcare facility emissions. The second one is the energy sources that we all know, the electricity and how it is generated in our country. So we need to invest in and advocate for decarbonization of local and national energy system and implementation of clean renewable energies. And of course, the third one is the supply chain, with which the production of the equipment, the procurement equipment, and also the disposal of medicines, drugs, and all the other material. So we need to set and implement criteria for low carbon or zero emissions procurement to decarbonize the supply chain. These are three main the areas which I mentioned. So maximum 81% is basically by the supply chain, and the 11% is scope 2, that's the energy sources, and 8% is by the healthcare facilities themselves and the vehicles being used in that. So why do we need to, from the healthcare system point of view, why do we need to invest in climate resilient and environmentally sustainable healthcare facilities? Just two examples, one from India and one from US. In Kerala, in 2018, we saw that hospitals faced power outages, and so some 3 to 9 days, and even the cold storage systems were shut down. There's no damage to entire stock of vaccines, other refrigerant-dependent medical supplies, damage to IT equipment, and also, of course, the inability to cater to the patients, especially the emergencies. That was, I think, another important loss. Not only which is much more than the financial loss as such. 2012 Hurricane Sandy in USA, which forced an evacuation of more than 6,400 patients from 6 hospitals, and New York University Langone Center was one of the centers most damaged, and it was fully closed for 2 months and without emergency room for a year and a half. So there are numerous examples. I've just given shared 2 with this August gathering. And even recently, when the severe rains in few parts of our country in India, so it is definitely impacting the healthcare facilities in those localities. So how do we move towards the climate smart healthcare? So we need to look at the transformative action in 2 dimensions: the adaptation or resilience, as we say, and mitigation and greening. So we need to have a climate prepared health systems and also decarbonized health systems as such. So the 2017 MAHE Declaration on Building Health System Resilience to Climate Change. So all 11 member states in the 70th session WHO Regional Committee committed to building health system resilience to climate change. So we are a signatory to that. And what were the 7 key elements in climate smart healthcare in 2017, which was discussed and deliberated upon, is the overall system design for coordinated care, emphasis on local providers, and driven by public health needs. The building design and construction based on low carbon approaches, investment in renewable energy and energy efficiency, waste minimization and sustainable healthcare waste management, sustainable transport and water consumption policies, low carbon procurement policies for pharmaceuticals, medical devices, food and other products, and resilience strategies to withstand extreme weather events and anchor sustainable communities. These are the fundamental, as per WHO 2020 report, the fundamental requirements are health workforce, not only the numbers, but they need to be empowered and informed to respond to environmental challenges. The capacity building in this matter is very important. Water, sanitation, hygiene, healthcare, waste management, so which is sustainable and safe. Energy, again, sustainable energy services, and infrastructure, technologies and products. Appropriate infrastructure, technologies, products and processes, which allow for efficient functioning of the facilities. So what have been India's initiatives to reduce the impact of climate change? I'll start from general and then I'll come to the health sector as such. So in 2006, there's a formulation of National Environment Policy. Ministry of Environment, Forest and Climate Change was nominated as the nodal ministry for matters related to climate change. Prime Minister's Council on Climate Change was formulated to advise proactive measures and facilitate interministerial coordination and guide policy. National Action Plan on Climate Change, NAPCC, was released by the then Honorable PM in June 2008. These are the 8 national missions which were launched in 2008. So India has been taking the climate change impact very seriously from few years ago. The National Mission on Sustainable Habitat, National Mission for Sustaining the Himalayan Ecosystem, National Mission for Sustainable Agriculture, National Solar Mission, National Mission for Enhanced Energy Efficiency, National Water Mission, National Mission on Strategic Knowledge for Climate Change, and National Mission for Green India. In 2015, this progress was reviewed. The Prime Minister Council on Climate Change was reconstituted, and 4 new missions to the already existing 8 were added. And health came as number 1 in these 4 new ones which were added. Health mission. So the National Mission on Waste to Energy Generation, National Mission on India's coastal areas, and National Wind Mission. So out of 10 missions, health has its own mission in the revised schema of things. And the health mission under NAPCC, the MOHFW is the nodal and which constituted a national expert group on climate change and health, which was tasked to prepare an action plan, recommend strategies for adaptation and response, and also plan for diseases occurring due to climate variability and change. NCDC was made nodal by the Ministry of Health and Family Welfare for all these activities. So this National Program for Climate Change and Human Health, NPCCHH, was launched in 2019 with a vision of strengthening the healthcare services for all citizens of India, especially vulnerable populations, the children, women, and marginalized, against climate-sensitive diseases. And the goal was to reduce morbidity, mortality, injuries, and health vulnerability due to climate variability and extreme weather. And of course, the objectives to strengthen healthcare services against the adverse impact of climate change on health. The specific objectives, it has 5 specific objectives: to create awareness among general population, the IEC and BCC activities, healthcare providers and policymakers regarding impact of climate change on human health, to strengthen the capacity of healthcare system to reduce illnesses and disease due to variability in climate, to strengthen health preparedness and response by performing situation analysis at all levels, to develop partnerships and create synchrony and energy with other missions and ensure that health is adequately represented in climate change agenda in the country, and to strengthen research capacity to fill the evidence gap on climate change impact on human health. I'll address all these objectives when I discuss what all government has done in the last few years. So the overall concept is to have green healthcare facilities at the mitigation, and the climate resilient healthcare facility, that's the adaptation. And I think I won't be reading this slide as such. You all are aware that green healthcare facilities, the sustainable low carbon solutions, and climate resilient mentions to facility to adapt, reorganize, and evolve, or to be prepared for better future, prepared better for future disasters. So this is a strategic framework. Number 1 is to strengthen and develop coordination for health-related early warning and surveillance system specific areas. So when I discussed with Pradhan Mantri Ayushman Bharat Health Infrastructure Mission, this strategy would be answered, and how integrated disease surveillance system has been put in place now, looking not only physical structures but also leveraging technology of integrated health information portal. Feedback mechanism to other ministries responsible for several ecological determinants of health: air, water, food, fuel, and human resource. And the Ministry of Health is working closely with all these ministries on all these aspects. Risk map for climate sensitive disease for each geographical area, that is being done by NCDC. And now with the 4 new branches of NCDC coming up very shortly under PM Abhim, and their linkages with the state public health lab, district public health labs, and block public health units. So this kind of geographical mapping is going to be on ground available from 25-26 onwards when all these are on place. Strengthening response action based on innovative or new strategies for technical approaches for increasing access, early healthcare, referral and health tracking incorporating Aadhaar number. So that's why Ayushman Bharat Digital Mission has been launched, and you know, with the Aadhaar, with the ABHA ID, every individual's record is going to be available over there in longitudinal manner. All the apps and systems currently being used by the health system, the eventual data will be part of the ABDM stack, and based on this kind of data availability, with dashboards available at all levels, starting from block onwards, and even with the health functionaries, we can have, you know, newer innovative approaches for accessibility, for also early advice, early referral, and also early response by the system. And of course, case studies and research and pilot test new approaches, and that's what we also do from NHSRC implementation research on all these aspects. So when we talk of, you know, the green healthcare, the building and infrastructure, the guidelines have been issued that what kind of the brown field of a green field, what are the kind of land which could be, you know, looked at. The infrastructure, again, complete details have been given. I'll be sharing with you a few of those details. Natural resources, air, water, energy, food. So for energy, like we are looking at, you know, both the models, the on-grid solar as well as off-grid. What we have recommended is that district hospital and above, where the grid is easily available, and you know the arrangement could be done with the private players in a PPP mode. We can have on-grid solar availability for CHC and above. Some CHCs which are near district headquarters, probably they could also look at on-grid. But CHC and below, we are recommending off-grid model. Though there's an issue of batteries in off-grid model, but again, we are discussing with various, you know, technical partners how to address that too, and make sure that every 7 years when the battery is being changed, how their life can be, you know, increased, and what could be the other alternatives as such. Waste management, not only sewage treatment plant, but also effluent treatment plants in each and every facility. Sustainable procurement. So again, this is one is in Make in India, that all are being made in India. Secondly, there is a biomedical equipment management program which is now being strengthened. So it is going beyond procurement. We are also looking at, you know, reducing the wastage of equipment. So let us increase the life of equipment by adequate, you know, preventive maintenance, and also regular repairs and all if required. And procurement systems are now being put in place, and we are helping the states, like looking at the Tamil Nadu model and some other states model, where medical supplies corporations have now been set up. The transport and communications and information services, again, the ambulance and all, the Ministry of Road Transports and Highways already given guidelines for ambulances. So now we are again discussing with them how these could also be made, you know, more eco-friendly as such. Site selection I've already mentioned while discussing the building infrastructure, that even site is also the specific guidelines, and to look at, you know, to not have an adverse impact on the climate as such. And also, of course, the site selection not only impact on the climate, but also on the facility in case of any flooding or earthquake in that area. So we do the mapping of climate vulnerability, disease vulnerability, so state level stats and local patient footfall. But I've given you the vision also 25 till 25-26. This is what is being done now. There's a health audit which is being done, energy audit which is being done, capacity building, training workshops, webinars, guidance being done by the NCDC and other nodal agencies, and also IEC material on air pollution, heat waves, vector-borne diseases, waterborne diseases, post-traumatic stress, etc. So this is the incremental approach, and energy, as I mentioned earlier, renewable energy, solar power, both models, on grid, off grid, energy efficient medical equipment. We are now looking at, you know, and even for not only even non-medical equipment in the health facilities, minimum 3-star rating and above. Similarly, we are, you know, discussing with the manufacturers that they have to look at energy efficient medical equipment also, lighting, cool roofs, and rainwater harvesting for all facilities, wastewater recycling, good water metering as such to prevent wastage of water, safe and appropriate waste handling, disposable, sewage treatment plants, different treatment plants I've already mentioned. The newer facilities, these are being, you know, made mandatory So all these what I am showing on this slide, these are now being mandatory for the newer facilities. As such, even older facilities, we've asked them if a retrofitting could be done, rainwater harvesting system can be done there. Solar energy, of course, the rooftops are available. LED lighting, the lights could be changed whenever the lights need to be changed. It could be replaced by the LED. And if ETPs, many of the facilities have even sewage treatment plant, how to connect with the local treatment plant. Those also have been discussed with the states. This is what, as per the national plan, national program, is that initial activities over first 2 years from 2019 onwards, the environmental health cells have been established in State Health Department. State nodal officers have been identified for climate change in State Health Department. Task force has been notified, representation of various health programs and ministries. State-specific health protection plans are being prepared for extreme weather events. The health departments have been asked to identify and strengthen department or organization or healthcare facilities, other stakeholders, for management of cases and monitoring and surveillance of climate-sensitive illnesses. The program is coordinating with premier institutes for developing training modules and guidelines. A lot of these have been made also. And integrate and implement a media communication plan for CSTs involving health determining sectors and communities. So in 2 to 5 years, the next phase, specific implementation framework for climate sensitive diseases will be made. There's a contingency plan for climate sensitive illnesses and capacity building and training of healthcare personnel on guidelines and treatment modalities. Early detection tools for climate sensitive diseases, which could be diagnostics, surveillance, and or mathematical modeling or prediction models, and of course periodic reviews for improvements or deterioration of indicators, vulnerability response capacity, preparedness, and environmental determinants for each climate sensitive disease. Continuing with the 2 to 5 years, again, awareness generation, IEC and BCC activities involving the community, local leaders, and advocacy network meetings and health talks, specific day celebration. So we have 45 days designated to be observed by every health and wellness center, which is coming up now in the entire country, and the environment also is part of that. So where it is being observed at each level. Adapt new technologies, building design, energy, water, sanitation. So the program authorities and CDC being nodal, also in contact with the NBCC in all the meetings and all. So they look at newer kind of building designs and all, which are energy saving and water and sanitation provisions as this have been made mandatory now. Linking data on climate sensitive disease and environmental factors. Again, this will now be improved once the PM all these expenditure is done over the next 3 to 4 years. Risk mapping and seasonal trends for including multi-center management approach, and research and epidemiological studies surveys, vulnerable population on all the climate sensitive diseases. Long term, of course, is evaluation and monitoring, of course, the continuous effort right now which is going on, evaluation of these activities, favorable legislation and policies which are being put in place, training to reach healthcare staff till the village level, dissemination of the good practices, update monitoring and surveillance system, evaluate interdisciplinary platforms and upgrade, and of course commissioning of the impact studies which will be required. The expected output from the program as such is the behavior modification, awareness and behavior modification for impact, illnesses, prevention, adaptive measures, increase in trained health personnel, and of course equipped institutes and organizations towards achievement of these services and infrastructure at district level in each state. Integrated monitoring system for collection analysis of health-related data with even meteorological parameters, environmental. So that One Health approach, if you see it under PM that all these is basically emanated for these kinds of inputs which were there in the program as such. And regulation of key environmental determinants of health, air quality, water quality, food, waste management, agriculture, transport, and support, evidence-based support to policymakers, program planners, and other stakeholders. So at the district level, the NPCCHH basically has, these are 3 major components: awareness generation, capacity building, and surveillance. So IEC, BCC campaigns, public health advisories, observance of important days of environmental health I've already mentioned earlier, and monitoring and supervision of IEC and BCC. So there's a training on climate change and health or capacity building which has been done. It's not only being planned for the healthcare workers but also for the community, because each health and wellness center now has a Jan Arogya Samiti, and up to from sub-center and PHC level. CHC and above is the Rohi Kalyan Samiti. So even these also are, these people are also part of the capacity building on climate change and health, and sensitization, knowledge building workshops are being held for these people too. Surveillance again for heat-related as well as air pollution-related illnesses in all states. For state-specific plan, where the lot of flexibility has been given to states to address this in terms of their geography, their climate conditions, their resources, urbanization, and health-related infrastructure. So it within this, each state is coming up with its own kind of plan to mitigate this, and some examples if you see of the and few of these facilities in various states, like in Kumbhali is running on solar energy. There's a labor room in Manipur with efficient equipment and solar energy as such. There's a portable solar power testing kiosk for COVID-19 was set up across Meghalaya. And the primary health center in Sambalpur powered by solar energy. These are the off-grid model. Cold chain Manipur powered by solar energy. Mobile health services powered by solar energy. There's a solar powered basic needs in health centers. Few of the the analyzers in lab. Few of the equipment directly linked with connected to the solar power. There's the boat clinics which are part of the Brahmaputra. So they are also using solar power. Efficient labor rooms in also utilizing these facilities, and the model health centers again using solar power, mobile healthcare vans, solar powered health kits, health centers, DRE cold chain solutions, maternity waiting homes implementation that provide safe and comfortable space for mothers and families, solar powered NCD kits, and even physiotherapy kits are there. Again, this is a larger facility. So there's a 100-bed inpatient department, a separate chemo unit for 50 patients built in Bihar. There's a Doctors for You which built this. So, but there are many other district hospitals now which are looking at the on-grid model also. I'll now come to a few of the other relevant programs, but these are complementary to the other healthcare facilities, because without this it is not possible. So how are we decarbonizing the healthcare? So prevention and health promotion as such. So decarbonization is a word which is being used everywhere, but it starts from preventing the diseases. So preventing people from getting ill. So that's why the Government of India's initiative of to provide comprehensive primary health care and looking at prevention, promotion, early diagnosis, treatment, disability limitation, rehabilitation, palliation. So wellness component as such, which is now being being made part of all the health and welfare center activities. Community-based care again it will save people's transport requirements to the health facilities. That's another part of decarbonization of healthcare. The care pathways, continuum of care from the like Ayushman Bharat, which was launched in 2018. It has two components: Ayushman Bharat Health and Wellness Centers and Ayushman Bharat PMJ, Pradhan Mantri Jan Arogya Yojana, which is an insurance-based model, and 40% of the country's population is being covered in that. So once we have this care pathway, the people know that they have to go from which facility to which facility. So if you see, at least it will save a lot of time by their searching for a facility. And in fact, when the ambulance services, if you combine the national ambulance service with this, where we have more than 28,000 ambulances now, and we have recently relaxed the norms for the ALS and BLS. We say that one ALS it used to be one BLS per 1 lakh population and one ALS per 5 lakh population. We said no, it could be 50,000 for BLS and 2 to 3 lakh for ALS. So with the increased number of the ambulance services again, so it's not that people will have to use various modes of transport. So that also would decarbonize the healthcare. Digital health interventions again. So eSanjeevani, everyone knows. We have the NCD applications. We have the health and wellness center application. So even for dialysis, we have an application, and the numerous others are there. But as I mentioned earlier, under Ayushman Bharat Digital Mission, all these will get will talk to each other, and with the digital stack which is now available. So the patient may go to any facilities, instead of him or her being asked to go to some other. Entire data will be available to the functionaries, and they can add decision support system which will be part of that can easily tell them where to refer the patient or what kind of treatment to be given. And facilities and infrastructure, I think we have already mentioned earlier. the green facilities and all, but I'll flag few more points later on. But I must indulge you for some time in the comprehensive primary healthcare. Why I'm mentioning or the decarbonizing. If you see, those highlighted in blue is the continuum of care, telehealth, and red side robust IT system. So DHIs will save a lot of travel and it not only time as such, the opportunity cost, their daily wages, and also of course the requirement of fuel and the vehicle requirement. Similarly, the package of services, if you see, once these are available at the sub-center level, the communities travel to primary health center or CHC will be only on a referral basis. So again, we are saving a lot of energy spent on people's travel or the fossil fuels or other. So again, multi-skilling of HR, CHO, which will be required. Providing these diagnostics, if you see expanded medicine and diagnostics, if you the bottom right, here the number of medicines and number of tests which we are now trying to ensure. We are still working with the states, and once these tests are available at these facilities, again people will not have to travel for testing as such. And in case some tests which like in diagnostics in sub center, we say 14 will be point of care tests. In PHC, out of 63, 29 will be point of care. The rest could be in a district hospital or a CHC. So the patient doesn't have to travel. There's a one runner per district or a few runners per district, which will take the sample to CHC or district hospital in a hub and spoke model. That's what we say. So it will be saving a lot of people, traveling there. And again, community mobilization, so that they are fully involved and they also are aware of the climate change also. So that's another important aspect which is part of the comprehensive primary healthcare. These are a few of the features, if you see, which are now being supported by the Government of India, and some of these are mandatory as such in all the new building. Use of rainwater harvesting, solar energy efficient equipment, low energy LED lighting, alternate low energy options. I have already mentioned these earlier, but just to flag them once more: renewable energy, battery backups. I have mentioned CFC-free refrigerants in HVAC equipment, low greenhouse warming potential, solar reflective, that means cool rooftops, sludge treatment plant, and also the ETP and STP, and retrofitting, of course, the ones which are already there with climate disaster resilient district as per the IPHS guidelines. So what is this IPHS, Indian Public Health Standards 2022? Because they were first time launched in 2007, revised in 2012. They were made by DGHS, but somehow 2022 has been made by NHSRC. So where we have mandated now 60% of the total area of facility to be reserved for landscaping, play area, circulation area, and remaining 35-40% only should be the plinth area. That includes the residential area of too. So here again, we are trying to prevent the travel of the healthcare workers from somewhere else to the health facility every morning and evening. So the residential areas are being now mandated as part of the new building. Vertical expansion is what is being now recommended instead of horizontal, to ensure more space for creating green spaces. Electrical appliances, I mentioned earlier, 3-star rating, and fitment requirement water supply to safe rainwater, clean rainwater harvesting system, reduce the municipal water demand, and enhance the ground table, of course. Separate drainage system, ETP, STP, I've already mentioned earlier. Biomedical waste. So the emphasis is now also being given on collection, transportation, treatment, disposal of biomedical waste as per the latest rules. CSSD and mechanical laundry. Again, newer equipments are available which save a lot of water, especially in mechanized laundry, instead of the older system of which was heavily water dependent and of course also polluting the nearby streams or even the land as such. So these are now also being mandated with latest technology, and it will also prevent hospital-acquired infection, definitely. But since I'm focusing on climate change, so I was mentioning about that. And of course, we have said that all facilities should be capable of handling certain healthcare needs during disasters and unforeseen emergencies. That's why infrastructure has to be such, and critical care blocks are coming up now. HR training on all these procedures, and decontamination areas for the CBR and chemical, biological, radiological, and nuclear emergencies as such. This is another initiative of how we can push people for climate resilient and eco-friendly facilities. So Kayakalp Awards, and of course, today's news now it says that the government has said it will no longer be an award because it's an incentive scheme. But incentive scheme will continue. We may not use the word. We may drop the word award as such, but Kayakalp will continue, which is part of the National Quality Assurance program of the country, launched in 2013. Kayakalp was launched in 2015, 2 years after the National Quality Assurance program, and later on to implement in all district hospitals, then expanded to CHCs and PHCs, and of course currently being implemented all levels of public health facilities. So these are the objectives of Kayakalp: to promote cleanliness, hygiene, and infection control practices, incentivize and recognize such public healthcare facilities that show exemplary performance and adhering to standard protocols, a culture of ongoing assessment and peer review of performance related to hygiene, cleanliness, and sanitation, and of course shared practices, and Mera's client satisfaction is part of that. And so this is the 8 thematic areas: the upkeep, sanitation, hygiene, waste management, infection control, support services, hygiene promotion, cleanliness beyond the hospital facility boundary wall. And this 8th one was added last year only: eco-friendly facility. So eco-friendly facility looks at energy efficiency, air and noise pollution, reduction and reuse and recycling of waste, save the earth and the environment, and health and well-being. So of course these awards, and there's a huge amount of money which is there. District hospitals 10 lakh and 5 lakh to the best eco-friendly district hospital CHC facility, which they can further utilize to strengthen and improve their facility. And again, biomedical waste management, as per the latest guidelines, we streamline and standardize the entire activities: collection, transport, treatment, and disposal of waste, and along with monitoring and regulation, and of course legal and regulatory framework medical. There are the sub themes under hospital biomedical waste management: implementation of rules, segregation, shafts management, biomedical waste storage, disposal, management of waste, solid waste management, liquid waste management, equipment and supplies of BMW, statutory compliances. So all these are being addressed under this scheme of Kayakalp. And there's another interesting Swachh Swasth Sarvatra, which is launched under Swachh Bharat Abhiyan 2016. I remember in 1989 December, when I joined my MD Preventive and Social Medicine, and the first talk was on environment by one of our teachers, and his initial opening sentence was that when there's a dust storm in a country, so whatever the dust enters your eyes or mouth or ears or nose is basically fecal dust. So that was the extent of open defecation in our country that time. But very hearteningly now, it's almost all villages are ODF, open defecation free. And 2016 this was launched at all the ODF village blocks, where their money was being given to the community health centers to strengthen and to meet the Kayakalp standard. So it was both. Once it was ODF, more incentivization was given to convert it into the Kayakalp. And of course, training is part of that in WASH and from CHC and PHC level 2. PMABHEEM and Finance Commission grants I have already alluded to earlier, but how it will affect the health sector as such in the climate change which is now taking place. So IT-enabled disease surveillance system is being now expanded and built upon. Network of surveillance labs I mentioned earlier, block public health units, BPHUs, which will have a laboratory as well as the clinical part, the management part, and the data management part. At district level, we are now coming up with integrated district public health labs. So all district will have a integrated district public health lab by 25-26. So it's in a phased manner. And the funds basically coming from both. We have 100,000 crores from 21-22 to 25-26 under these two schemes combined only. So this in addition to the National Health Mission grants every year, in addition to the emergency COVID response packages 1 and 2, 18,000 crores for 1 and 23,000 crores for 2. So this is over and above this. So you just see that the largest infrastructure mission and the scheme which has ever been thought of in our country. So the central sector component of PMABHEEM is the NCDC branches and NIV branches all over the country, the 5 branches each. So as I mentioned earlier, there's a block public health unit which is looking at all the functions, which is going beyond the lab test and clinical part, also looking at surveillance and linked with the integrated district public health lab, linked with the state public health lab, and of course linkages with the NCDC and National Institute of Virology. The 50 points of entry, the land, sea, and air, they are now being strengthened under PMABHEEM to ensure that next time there's a pandemic like COVID, our borders are strengthened to detect it as early as possible. And of course, in metropolitan areas, we're coming up with those labs. for, of course, detecting, investigating, preventing, and combating any kind of public health emergency disease outbreaks. This could come from outside, it could be inside. Climate change is going to, I think, create a lot of such emergencies again and again, and it's on us that how to prevent it to become an emergency with the early warning signals, and with this kind of linkages that capabilities will be there. So biosecurity preparedness and pandemic research I have already mentioned, and One Institute of One Health is also coming up, which is looking at it in totality. And when we talk of integrated district public health labs, we have the appointment of the epidemiologist also there, and even entomologists can be employed over there. So again, linkages also will strengthen, and the capabilities also will strengthen. So 15 health emergency operation centers are also coming up, and 2 container-based mobile hospitals to be moved in case of any kind of emergency. Building less sub-centers, primary health centers and CHCs, again, the grant as per these grants, and the as per revised Indian Public Health Service Standards of 2022, which I just shared with you, few of the provisions with entire consideration to the environment, and vertical instead of expansion, horizontal wherever expansion or new development is coming up. So this is just again a little bit more about the ABH Abhi. If you see on the right side, central sector components, critical care hospital blocks are coming up. Again, it will be providing critical care service at district hospital level. 602 districts are going to come up with the critical care hospital blocks, 50 to 100 bedded, depending on the population of the unit. Surveillance, I have already mentioned earlier, disaster and epidemic preparedness, pandemic research, urban and rural health and wellness centers are being strengthened, block public health units, integrated district public health labs, critical care blocks in all the districts. So 12 central institutions and 602 districts. So this is the extent of PM Abhim. And Finance Commission, if you see, rural component is again to building less, whichever states were not covered by the PM Abhim, the rest are being covered by they are complementary to each other, these 2 schemes. Block public health units, again, which are not covered by PM Abhim, are being covered by the 15th Command Commission grants. Diagnostics, again, as I mentioned earlier, that also leads to a lot of out-of-pocket expenditure, and also affect to the environment because people are traveling. And conversion of rural PHCs to health and wellness centers, where wellness is now the component and the community-based care is being looked at. Urban, again, diagnostic at primary health facilities, and a new facility which has come up, which instead now we have primary health centers and community health centers in the urban area. This will now come up with the urban health and wellness centers. So again, it is nearer to people. Each urban HWC at 15 to 20,000 population. So we're providing services as close as possible to the people. So the last few slides, the health sector response, of course, is central in as a way forward. We have to align with the global frameworks and guidelines, while again contextualizing for India, and that's what, if you see PM Abhim and Finance Commission both combined. I'd like to mention here the emergency COVID response package 1 and 2. 1 basically was immediate response, where money was given to states for drugs and diagnostics. Sorry. 2 was basically looked at infrastructure for the hospital construction, and also centers of excellence for pediatric ICUs, HDUs, and also oxygen. So again, the health system was strengthened as such. So decentralization, as solar, I have given you one example earlier, that each state and each facility has to decide, and one size does not fit all. And intersectoral coordination, of course, because we need to, we are the coordination, if you see at national level, even though there is a lot needs to be done, more needs to be done for intersectoral coordination, but it is there, it is starting to gain pace with the water ministry, the environment ministry, the Panchayati Raj institutions. At NHSRC, our divisions, all divisions are are part of this initiative. The QPS division, Quality and Patient Safety division, which is nodal for Kayakalp scheme, and even guidelines of management healthcare waste. The division was part of that. Public Health Administration division has come up with the IPHS standards, the involvement framing of the entire NPCCHS guidelines, which was launched in 2019. The Community Processes and Comprehensive Primary Healthcare division, again CPHC, General Samitis and Wellness, I have mentioned earlier how they are linked with the climate change. And HRH, HPIB, Human Resource for Health and Integrated Planning Division looks at capacity building of healthcare workers. So even when we talk of capacity building for climate change, NHSRC is involved, because all the health functionaries are to district hospital level from the sub-center level. including ASHAs also. We are responsible for that capacity building. Knowledge Management Division looks at the research and knowledge management. Healthcare Technology is now looking at technical specifications and technology, how to make them, aligned with the climate change policies, and also health technology evaluation. The accounts and research, of course, National Health Accounts, State Health Accounts are being a healthcare financing division, which looks at what are the sources of funds, where are being spent, and even technology, how much is being spent and where, and again, Make in India component also. With that, I would like to stop here. Thank you very much.
We agree. The kind of climate resilient policies and programs that have been enacted, I think you covered right from the history to what are the current developments and what should be the future direction. So to cover all this in 1 hour, it's extremely difficult, but you gave us an overview and created a curiosity among us to look further how academic institutions can get involved at national level, state level, and district level to contribute to this noble cause of climate resilient health systems. So there are a few questions I'll ask maybe in the next 5 to 10 minutes. I think we have some time. Sir, we have a question. Is it okay? Can I ask you a question, sir, now?
Yes, please.
This question is from our patron, Professor Rajani Prasanna. Which state has made the best progress in health sector in the context of adapting to the climate change?
Professor Rajani, thank you very much for this question. It's difficult to say right now because the state health index and all by NITI and all doesn't give that much of importance to this. But again, if you look at the states like southern states like Tamil Nadu, which definitely is much ahead, not only in provision of health services but also looking at the climate change aspects too. But again, the ranking has not been done as such by the program because all states are in the process of moving towards climate resilient facilities as well as implementing all these policies. But overall, if you see, each state is attempting. Like very heartening to see northeastern states looking at solar energy and for their facilities, and even the newer facilities which are coming up now for the water harvesting and all the other ETPs and all are coming up. So there's no clear-cut state which is the best one which to say. But again, southern states definitely are much ahead because they looked at solar much earlier. But now Odisha and Northeast is catching up for these two. I hope I have answered your question partially as such.
Thank you, sir. The second question is in the context of because as the climate change is transdisciplinary in nature, so in that context, how meteorological parameters will be monitored or used in the surveillance of health-related data, meteorological data integration into the climate change data. So,
yeah. I'll just share with you something from my own personal experience. Armed forces got very robust, public health system as such. We have in every station, army cantonment, we have a, station health officer, OC, station health organization, which is headed by a public health officer, or we have a field health organization in the field areas, where again headed by a public health specialist, and we have in every headquarter we have a public health specialist as such. So for us, climate meteorological parameters are very important, and from very beginning, we use these instruments, and to even to decide things like severe physical exertion, when nomograms have been made over a period of time, and the temperature and humidity when the lines crisscross, we know that okay, today the kind of 5-kilometer run or 10-kilometer run with weight and all should not be done. That kind of advisory we give. So that's just one example which I am sharing with you. But of course, now as I've shared with you the block public health units and integrated district public health lab. So currently, to begin with, at the integrated district public health lab, where we have thought of meteorological equipment. And since that will have the capability, the specialists will also be there, and that linked with the meteorological department. So starting from district and above, those equipment would be available, where again it could be used in surveillance and linked with the health-related events which take place in the district level. So that's the kind of capability which is now being built in.
Okay,
but
sir.
currently there's only one district, very few district public health labs which are functional. But if as I shared with you, by 25-26 these have to come up. So they are coming up right now in various states.
Absolutely, sir. I think in your presentation, what was very clear to us is incremental approach. What we have done first 2 years, then what we will do 2 to 5 years, and next 15 years. I think that gives us an opportunity for us as an academic, in collaboration with government, NGOs, and administration, how we can actually participate in these events. And definitely, we look forward for your guidance in that context, sir. So the next question to you is in the context of how do you think the initiatives taken by the government at various levels impact India's power to steer the climate and health security concerns at global stage, especially in their upcoming G20 presidency, sir? More geopolitical in nature.
Thank you. This is from Aniruddha Ravindra. I'm also reading the chat along with this. Thank you. Thanks for this question. In fact, from today, 2 to 4, we had a meeting chaired by Shri Lava Agarwal, who's the Additional Secretary now, the Ministry of Health and Family Welfare. I think he's a known face during COVID. He was Joint Secretary and he used to come for the press briefings. So the meeting was next step, basically consultation meeting on G20 India's presidency, and in the main 3 priority areas. One of them will definitely cover the resilient health systems. Where are we now? What worked and what did not work, and also universal health coverage. So that's part of the discussion. That's where we're going to showcase that what India is from the learnings of COVID, instead of withdrawing and sitting back. From the learnings of COVID, how they have been utilized to at least think for the future. And that's what we need to we would like to flag over there, that what are the our security concerns. Of course, as I mentioned earlier to begin with, which I very firmly believe that the Western world has to do much more than what they are saying, and we are responsible for 6 to 7% of the global climate change, the emissions as such. So we need to they need to understand our developmental concerns and link our targets with that. Notwithstanding that, I'm talking from the health point of view. Beyond that, I think we need to, probably the other ministries would be probably doing it. From the health point of view, we're definitely going to flag that how we are addressing the climate change from the health perspective. Few of them I have shared with you, and of course, we'll work more on how to showcase it, even showcase the best practices, including some kind of exhibition and all also, where when I've shown you a few photographs, we can show some more, and even district public health lab and all, how we are aligning this thing and how we can look at surveillance systems and all.
Thank you, sir. Thank you for that. I think at school, we have taken the G20 presidency and the activities which we can contribute from the school level. I think the climate resilient health systems and transnational nature of the climate change also is of keen interest for us in the school, and we'll take up your suggestions, sir. Sir, we have a question from one of our very close associate from Nepal, Professor Paras. He has asked in the context of creating knowledge generating universities in the context of Center for Planetary Health. So requesting for your comment on that, sir.
Actually, yeah. So if you could, someone could elaborate the question, this thing, that what is being envisaged to create a university as such, or even only knowledge sharing as such?
Knowledge sharing, sir, particularly knowledge sharing, sir.
Yeah. Okay, that yes, that's why I mentioned, the knowledge management division of NHSRC was started last year only. We did not have it earlier. So definitely, I think much more needs to be done with knowledge sharing. We don't have the kind of repositories which people could refer to. So this is a point which we have discussed earlier, but we need to work on it. Currently, we have not worked on it, and I think we need to flag this to NCDC, and definitely we need to create a platform for knowledge sharing from the program. So there's a program, the website is there, but then of course the kind of knowledge documents which are available there are just a routine the documents shared by the issued by the various organizations there. but we need to share much more. We need to generate some evidence. We need to create, do some research and all, and work on that. Yeah, definitely. Point well
Sure,
taken.
sir. Sure, sir. I think what I get from this is we have a scope for transnational collaboration as well as a collaboration at the national level to exchange the knowledge as well as best practices, not only at the national level but also in the transnational nature. Sir, I have last two questions to you. We have under 7 to 8 minutes. Sir, how we understood that there are no currently indices for measuring climate adaptation. So one question is, how does the government plan to develop impact evaluation strategies and formulate any specific indicators to quantify it, and how we can as an university get involved in developing the indices, sir?
I think indicators have been developed by the program as such. I don't have the complete list with me, but the national program of climate change and health, this thing is already developed indicators. So impact evaluation, as I mentioned, will start much later, but the indicators already been developed. But it's a good thing, a good question that probably we can, look at those indicators again and see how we need to, modify those, and also start instead of waiting for the impact, we can do some kind of concurrent evaluation along with that. So that I think we can partner on that, and we need to discuss. We can do that.
Sure, sir. Sure. Thank you so much, sir. And the last question to you, sir, is in the context of as the climate is interdisciplinary and transnational in nature, how well our policies are transdisciplinary in nature? Because I saw several health missions were presented. I think beyond health sector, there are other sectors who are involved in this. So how do we tackle this integration horizontally, sir?
That's the, you see, we have been talking about interministerial coordination, intersectoral coordination, but again, I think a lot needs to be done at the national level and even at the state levels. So the policies are there, but again, like we recently attended a meeting with the water sanitation and all, because the additional secretary used to be here earlier, so that's why we became part of that. And but yes, these 12 missions as such, they need to sit together and discuss, and that has not been done as such as yet. So we need to do much more than this. We are currently working in silos in every ministry with some efforts to coordination, which is much more than what it was earlier. We are now constantly in dialogue with the water and sanitation, and also environment and forest. Of course, we definitely do, because a lot of policies emanate from there. Rural Panchayati Raj institutions, again, we are interacting with them. So Ministry of Health is now expanding gradually, but it's much more that needs to be done, and all these 12, of course, look at integrate these activities as such.
Thank you, sir. At Prasanna School of Public Health, sir, we have Manipal Multidisciplinary Center for Climate Studies, sir. So in that context, some of the activities are planned is in the context of stakeholder consultations and policy dialogue series. So we will approach you, sir, in talking about integrating the policies and how it can be done. I think this insight will help us to plan our stakeholder consultations and policy dialogue better. So these are our set of questions, sir. We really thank for your time, and we are very happy to note that our students, our alumni, few heads of the institutions in Manipal and also outside Manipal have joined this event today. And also we note the presence of our chief patron, Shri D.A. Prasanna and Professor Rajani Prasanna in this event. And Professor Helmut Brand, who is the founding director of Prasanna School of Public Health, is also present. So with this short thank you note, I also thank Rahul, Vani, Viola, and Anirudh, who are here present with us, and other faculty colleagues of Prasanna School of Public Health.